Mr. President, thank you for allowing all of us to meet today to discuss our thoughts on such an important issue as healthcare reform. Healthcare expenditures are escalating rapidly. It is imperative that we come to an agreement on how to contain costs before all of the federal budget is spent on healthcare. The Centers for Disease Control stated in 2009, national health expenditures as a percent of the gross domestic product was 17.4%. The Centers for Medicare and Medicaid Services projects by the year 2020, healthcare expenditures will be almost 19.8% of the GDP. The United States healthcare system is the most expensive in the world. The United States spends more on healthcare than any other industrialized country, yet Americans have worse health outcomes. The most significant difference between the United States and these other countries is the lack of universal health care coverage. Two things need to be accomplished. Healthcare for Americans needs to improve, and healthcare expenditures needs to be reduced. After carefully analyzing the CDC trends in healthcare expenditures compiled from data from the Center for Medicare and Medicaid Services, I found 3 areas in which expenditures can be reduced while simultaneously increasing quality of care. These areas include hospitals and physicians, prescription drug costs, wasteful, inefficient spending. In the current fee-for-service system, hospitals and physicians have driven up healthcare costs, which comprise more than half of the national health expenditures. An excellent way to reduce the cost for these providers is to encourage the formation of accountable care organizations. An accountable care organization is a new healthcare delivery system that brings together a network of providers, such as primary care specialists, hospitals, home health care, and even private companies such as pharmacies, and holds them collectively accountable for the quality, cost, and total care of their patients. The purpose of accountable care organizations is to reward providers for lowering their patients' total cost of care received during the year. Total cost of care would decrease through reducing hospital visits, emergency room visits, expensive specialists, and testing services, which used to be in the past goals to make money, are now in the present incentives to reduce cost. Since accountable care organizations are comprised of a network of providers, holistic, good quality care will be provided by coordinating patients' care from prevention through disease management. The Congressional Budget Office has estimated that potential savings to Medicare for accountable care organizations could be about $5.3 billion between 2010 and 2019. Another way to reduce costs of physicians is to increase the utilization of nurse practitioners whenever possible. Per the American Association of Nurse Practitioners, decades of research have shown that nurse practitioners can deliver similar quality to that provided by highly paid physicians. As far as cost, Medicare reimburses nurse practitioners at the rate of 80% of the lesser of the actual charge, or 85% of the scheduled amount for physicians. As a nurse practitioner, I strongly believe that anything that can be done to utilize nurse practitioners more in primary care and ensure that nurse practitioner patients be included in accountable care organizations will significantly improve the overall health outcome of patients while keeping costs down. Prescription drug costs in the United States are rapidly rising. Per the Centers for Disease Control, to approximately 10% of the total national health expenditures, which in 2009 was about $252 billion. I agree with the National Conference of State Legislature, who issued a brief on health cost containment strategies to help the government operate more efficiently and cost effectively. Their aim was to reduce overall spending but did not deny coverage or services. Some strategies to reduce the cost for prescription drugs include buying more generic prescription drugs rather than brand name equivalents is documented to save states 30 to 80% on certain widely used medications, saving millions of dollars annually. Buying generics also provides savings to local governments and Medicaid programs, but also to health insurers, employees, employers, and direct pay patients and consumers. Everyone benefits using generics. Purchasing brand name drugs with discounts can significantly reduce overall prescription drug expenditures. The Congressional Budget Office calculated a savings of $420 million in 2011, $710 million in 2012, and $790 million in 2013. Using preferred drug lists, supplemental rebates, and multi-state purchasing arrangements is proven to save between 8 to 12% on overall Medicaid drug purchases, saving states nationwide on average $1.8 billion annually. Another healthcare expenditure of great concern that is growing is wasteful spending. Spending that can be eliminated without reducing quality of care. Some examples include clinical waste, administrative waste, fraud, and abuse. Some strategies noted by the National Conference of State Legislature are clinical waste, spending that can be eliminated with better or higher quality initial care. Accountable care organizations can help with this. Overtreatment, eliminating unnecessary tests or diagnostic procedures. Accountable care organizations can help with this. Administrative waste, eliminating by promoting simpler, more standardized processes for performing administrative tasks. Eliminate paper billing, which costs nearly twice as much as electronic billing. Substantially reduce marketing costs. And last, fraud and abuse. Evidence shows that anti-state fraud and abuse efforts save states millions and in some cases billions of dollars each year. It appears the more anti-fraud tools a state has at its disposal, the greater chances of fewer unwarranted payouts and larger recoveries. From 1986 to 2010, using False Claims Act authority, states and federal governments recovered more than $20 billion. In order for the American people to receive quality health care, they must have access to health care. It is a fact people with reduced access to health care suffer worse health outcomes in comparison to those who receive full access. President Obama's Patient Protection Affordable Care Act does exactly this, provides universal health care, which is imperative to improve the health of the American people. Another issue that is imperative is reduction of the total cost of health care expenditures before it consumes any more of the federal budget. I strongly believe focusing on reducing costs for physicians and hospitals through accountable care organizations and utilization of nurse practitioners, reducing prescription drug costs, and eliminating wasteful spending will bend the cost curve while simultaneously improve health care of the American people. Again, thank you, Mr. President, for allowing us to meet today.